So one thing that makes me very different than many chiropractors is I'm a NUCCA chiropractor, or NUCCA certified chiropractor, making it so that I really focus a lot of my attention at the very top of the spine, because that's where I find a lot of people's original problem is that has started a lot of these other issues that they're dealing with in their bodies. And I do take care of the whole spine. I adjust the whole spine if needed, but a lot of areas that maybe a standard chiropractor might not assess or address as specifically as I would is the top of the spine, the upper cervical spine. So if your head is not sitting quite straight, you have a little shift to the left or the right, and this is something that we verify with postural analysis, but then eventually an x-ray that we can measure and then use that x-ray to make a correction and improve your alignment, right? So if your head is off, what's gonna happen is you don't actually walk around like this, you level your eyes out, but now your shoulders are on an angle, your hips are unlevel. That's all that unevenness and misalignment that we're talking about in terms of what can put the uneven pressure and wear and tear on the discs, and then eventually lead to disc bulging and then eventually even disc herniation, okay? So one way that I'm able to help people, and I've been able to do this with even people who have very active disc herniation. So the disc is literally, the nucleus pulposus is coming out of the disc, but if we can realign the spine through a very gentle adjustment to the top and straighten out and even out the pressure and even out the amount of weight that you're holding on one side of the body or the other, you can really take a lot of the pressure off the discs and alleviate a lot of the symptoms. So that's one way that I'm able to help people out. That's a little bit different than a standard chiropractor, and really why I think I get really great results with herniated discs and bulging discs.